All right. Good evening. My name is Jordan Rutan, and today I'm going to be presenting to you on oxytocin and vasopressin and the effects that they have on the body. So we know vasopressin and oxytocin are two hormones, but let's talk about where they come from real fast before we get into exactly what they do. So, vasopressin and oxytocin are produced in the posterior pituitary gland. If you look over here, we've got a nice little diagram. We've got our hypothalamus located up here, our anterior pituitary, and then our posterior pituitary. So, our hypothalamus, we've been discussing that this week in class, and we know that the hypothalamus controls homeostasis within the body, right? And so it sends a lot of its signals down to the anterior pituitary and the posterior pituitary, letting them know to release different hormones to go throughout the body to create different uh, functions that we see. So the hypothalamus, let's go over how it communicates with the anterior pituitary real fast, just as a review. The hypothalamus is connected to the anterior pituitary gland through portal circulation. Okay. The reason I'm going over this is just because it's different from the posterior pituitary, and I want to highlight the differences real fast. So, in order for the hypothalamus to communicate with the anterior pituitary gland, it has to send signals through this tiny little bloodstream right here, right? So we know this is a closed system. The capillaries in the hypothalamus can pick up signals that will travel through this vein, coming into the anterior pituitary where it branches back down into capillaries once again, releasing its hormones, its signals down into the anterior pituitary, which will then release excitatory or inhibitory hormones into the main bloodstream, right? And sends those signals throughout the body. When we're looking at the posterior pituitary, it's a little bit different. So instead of connecting through portal circulation, it connects through magnocellular neurons. Okay, so that's something the anterior pituitary doesn't get. It doesn't have direct neuron communication like the posterior pituitary does. So whenever the hypothalamus wants the posterior pituitary to release oxytocin or vasopressin, it's going to send a signal via the magnocellular neurons all the way down here, posterior pituitary. It tells it what to do, and then the posterior pituitary can release these hormones into the main circulatory system. Okay, so that's an overview of how that works. So let's go on to what oxytocin and vasopressin actually do. Okay, so let's start with oxytocin. Oxytocin is the hormone that mainly is present in females whenever they're giving birth, they're going into labor, or they are lactating. Okay, and so this occurs in a positive feedback loop. So let's go over how this happens real fast. So whenever a woman is pregnant and it's time for her to give birth, her body needs to go into labor, right? And so the baby is going to start pushing up against the woman's cervix. The cervix starts to stretch, which is going to send signals from all the way down here up to the hypothalamus. Okay, right? The hypothalamus is the portion of the brain that controls homeostasis. It controls what hormones are going to get sent out from the pituitary gland. Okay, so cervix is getting stretched. Signal goes up to the hypothalamus. The hypothalamus sends its signals through the magnocellular neurons to the posterior pituitary gland, saying, hey, we need to send oxytocin down to the uterus. It's time for the baby to come. It's time for contractions to occur. So the posterior pituitary gland releases oxytocin, which then travels all the way down through the main circulatory system to the uterus. And the uterine lining contains receptors that will allow oxytocin to bind to them, and this creates the rhythmic smooth muscle contraction that we see whenever labor is occurring. So remember, this is a positive feedback loop. So now that the body, right, the uterus has received this oxytocin, it's causing contractions to happen. Well, we need contractions to continue until the baby is actually born. So as contractions are occurring, right, the cervix is stretching even more, but we still need oxytocin to cause these contractions to happen. So as the cervix continues to stretch, it sends more signals back up to the hypothalamus, which will send signals back to the posterior pituitary gland through the magnocellular neurons. The posterior pituitary gland is going to release oxytocin back into the circulatory system. It travels all the way back to the uterine lining, binds to receptors, and which causes even more contractions. This is a positive feedback loop because as signals are sent up, more hormone is sent out. And so this continues until the baby is born. And then, of course, we don't need contractions anymore. And so signals are going to stop being sent to the hypothalamus, which is going to cause oxytocin to stop being sent back out. Okay. This also occurs, like I said, for lactation. So after the baby is born, in order for a woman to lactate, they need to have oxytocin as well. So it's the same kind of system. Whenever the baby's born, it's going to suckle on the breast. Whenever it suckles, that's going to cause a signal to be sent once again to the hypothalamus, which is going to send a signal to the posterior pituitary through the magnocellular neurons, which is going to send oxytocin down to the breast. They're going to stimulate milk production by causing the myoepithelial cells to contract, releasing milk. Okay, and once again, this is the positive feedback loop. As long as the baby is continuing to suckle on the breast, oxytocin is going to be sent down, so the myoepithelial cells will continue to secrete milk until the baby is filled and stops suckling on the breast. Okay, so that's oxytocin. All right, let's go on to the second hormone produced by the posterior pituitary gland. And this one is vasopressin. You might have heard it called ADH, or antidiuretic hormone. And so what it has a completely different function than oxytocin. So vasopressin is mainly used for water reabsorption or vasoconstriction. Okay, during different scenarios. So what happens is it works through the negative feedback loop. Okay, so once again, different than oxytocin. So whenever the body starts to become low in blood volume, or if maybe plasma osmolarity is increasing, and by plasma osmolarity, we simply just mean that there's too much sodium in the, there's too much sodium in the blood. We know water follows sodium. The more sodium in the blood, the less water we have. You're becoming dehydrated is what's happening. And so your body needs to absorb more water to dilute that sodium concentration that we're finding and to increase blood volume. And so whenever the body realizes it needs more water, it sends a signal up to the hypothalamus, once again, because that's our homeostatic regulator. It sends a signal to the posterior pituitary gland, and this time it tells it to release vasopressin. Vasopressin is going to travel to the kidney, and it goes even further than that. So when it reaches the kidney, it's going to travel down to the nephron. And at the nephron, it's going to travel even further. It's going to go into the collecting ducts, and it's going to affect the aquaporin channels. Okay, so the hypothalamus secretes the vasopressin, and it travels all the way through the kidney, through the nephron, through the collecting ducts, and to the principal cells, okay, that we find here in the nephron. This causes an increase in the expression of these aquaporin type 2 channels, okay, once again, that we're finding in the collecting duct. Okay, so these channels are going to open up. Okay, they're going to have increased expression. Okay, they're opening up, they're allowing more water to seep in. And this is occurring in the principal cells, in the distal convoluted tubules, and it's absorbing water. Okay, this is about how 10% of water reabsorption is going to occur whenever the blood-water ratio gets a little too low. And so as in the principal cells, the vasopressin is coming in, it's going to bind to the ADH2 receptors. This stimulates insertion of these aquaporin 2 channels on the apical surface of the principal cells, once again allowing the water to rush in. As water is absorbed, increase in blood volume, the blood volume is going to increase, and the plasma osmolarity is going to start decreasing. Okay, so we get more blood volume, we have higher blood pressure, and now our sodium levels are getting more diluted. Okay, and we said this is a negative feedback loop. So as our blood volume is increasing, as we're gaining more water, it's sending signals still up to the hypothalamus, but it's telling it, saying, hey, we don't need so much vasopressin down here. The aquaporin 2 channels are letting in enough water into the principal cells. We're, getting more water into the bloodstream, the sodium levels are decreasing, blood volume's increasing. We don't need so much vasopressin entering our system anymore. And so that's why this is called the negative feedback loop, because as signals are sent up to the hypothalamus, it tells it to stop releasing hormones. Okay, this is different than oxytocin. As it receives signals, it sends out more hormones, where with vasopressin, it's negative feedback. So as signals are sent to the hypothalamus, it stops releasing hormones. Okay, and so that's for water reabsorption. And then, like we said, it also helps with vasoconstriction. And so this is usually during whenever someone's experiencing severe blood loss or infection. Our vasopressin, or our ADH, comes in. It binds to ADH1 receptors on vascular smooth muscle cells, and that produces that contraction that we see. And it increases our peripheral vascular resistance, which causes our blood pressure to increase, which is going to be necessary whenever blood loss is occurring, or we have that infection. We need our blood pressure to stay up. So it's going to cause vasoconstriction as well. Okay, here are my references. I've got 2 pages real fast, so that way everybody can see them. Okay, so thank you for coming to my discussion, and have a good rest of your afternoon.